Welcome to Touch Revolution, the podcast where the value of thoughtful, helpful, and ethical touch is fully realized. Brought to you by Ke Kino Institute of Healing, a rigorous massage school and clinic. Join us on this journey as we delve into the world of touch therapy, exploring its powerful effects on the mind, body, and soul. So, get ready to embark on a captivating exploration of touch therapy. It's time to revolutionize the way we heal, one soothing touch at a time.
Today we have a very special guest from Holland. His name is Wilko Ledma. And we also have here as a guest co-host here, Marnie Manus. Wilko Ledma is from Holland and is a body worker of 41 years. I don't know if everybody knows how valuable time is as a body worker, but it really makes the difference in being a powerful body worker. Marnie is in our master level therapist program here, which is the highest level you can be at Kekino Institute of Healing. And I'm honored to have you guys here. We want to start with getting a little information from both of you about who you are, and let's say why you're here, and kind of a little bit of history about what made you. We're going to start with Marnie. Marnie?
Good morning. I became a massage therapist because I really wanted to be an osteopath. But because I had an osteopath who was able to get me out of pain during all my years as a corporate worker. But I was 40 years old and had a degree in finance. So medical school was a little bit big. So she said, why don't you become a massage therapist? And at the time, I thought that massage therapy was a luxury service for rich people. So why do I want to rub on people all day? She said, well, you can do most of the body work that I do. I said, oh, sign me up.
Mm-hmm.
And I went into medical massage, did a great job at it, hardcore, deep tissue, almost Rolfing kind of deep work. And then I met my mentor, Cersei Vogel, who used to work here. For 5 years. I spent 4 hours a week with Cersei doing light touch body work, cranial sacral, somato-emotional release. One day she posted on Facebook, that was a great cranial session, Marnie. And I said, what do you mean? I didn't even touch your head. She said, yeah, that's cranial. I thought we were doing some combination of myofascial and energy work. And but it completely changed my practice and my life. She also introduced me to neurosomatic work, so working with the emotions that are held in the tissues. And I started the process of doing my own internal healing at that time. And at some point, she said, Marnie, you really need to work at Kekino. You fit there better than me. And she's right. And here I am, just really honored to be doing this kind of work that I did not even know existed when I enrolled in massage school.
That's amazing. Thank you so much. We're glad you're here.
Thank you.
Wilko?
Thank you. Good morning. In 1981, I enrolled in School for Macrobiotics and Eastern Healing, and part of that was Zen Shiatsu, of which I had never heard. I had a very different life before that. So when I saw this guy giving a demo, I just got so excited. I saw it and I said, this is what I'm going to do. I just knew. Now, many years later, I'm still touching. It's never left my life, except it left my life at some points that I needed to work on myself and leave the work and do my inner work. And throughout the years, that's been my main discovery, and it still is a discovery, that to walk the talk helps to work with people in depth. So when I did the Zen Shiatsu, I started giving sessions very soon. I just wanted to pass it on. Somehow intuitively I knew learning by passing on works the best. That's the best method. So I did that. Also at that time, I came in touch with this breath therapy called rebirthing, connected breathing, which I had never heard of. I was warned about this dangerous method until I was asked to cook for a rebirthing group. I was also a macrobiotic cook. And these so many sounds came from this room. I thought this cannot be dangerous. And people came into the kitchen and they were looking so shiny and open. I thought I have some wrong information here. So I asked this group leader, can I join for a session? He said, sure, come in. So I entered this breathing session, and at some point I didn't even notice, but my breath just stopped. Later on, this guy told me, you turn blue. And someone just touched my belly. He said, it's okay, guy. And I just broke up. All my emotions that I didn't even know existed, they came out. And I was fascinated. So this is the power of breath. Since that time, my fascination for breath, the workings of breath combined with body work, combined with a healthy sense for stored up feelings, emotions, fear, anger, it has remained my fascination. And mainly also, and I keep telling clients, breath you have an influence on. Many other systems you don't have a conscious influence on them, but breathing you can do. If you're aware of breathing, you can change it. When you change your breathing, you start to feel more. When you start to feel more, that's not necessarily good news, but it's the best news you can get. So after some years of Zen Shiatsu, I just noticed many people got into processes that I was okay with facilitating it, but I was lacking skill. And then I ran into this training called rebalancing, which was given by some very good bodywork therapist from around Osho. A 3-month internal training in Italy, which was very powerful. So the big confrontation there for me in the beginning was that I thought I was a good toucher. And I found out that on the level of shiatsu, I was a good toucher, but there was so much more to learn. And I just couldn't take the feedback. I couldn't let myself be helped. I didn't want to admit that until someone just told me, hey, we cannot help you if you need to be open for that. So then I let myself be helped and a world opened up. A world opened up. We were turned inside out on all levels during these 3 months. And I remember coming back to Holland, I was just so begeisterd. I don't know if you know the word, so thrilled that I just told people I knew, you have to come on my table. I want to make you feel what I'm doing. I had quite a few friends at that time. They had their own small spiritual centers with yoga, with massage, with different skills. And they were so excited and touched that they asked me to come to their place. They would provide clients if I would come to do the sessions. So this is what I did for the first year, moving around, having my massage table on the train, going to these little centers, do 5 people on a day, and then go back home. That's where I embodied very much of the techniques. They came into my body, they came into my hands, and I understood this you learn by doing it, doing, doing, so that the touching gets this embodiment. Yeah.
Wilko, we
Yeah.
here at the Institute, we um, teach or hold the torch for the value of doing.
Yeah.
In a culture that has overvalued the linear aspects of learning.
Yeah.
Meaning, the culture is taking this very small sliver of what's available and moving it from not knowing to knowing. Kind of like brain surgery. We all know that brain surgery exists, and yet the acquiring that information to learn how to do it is still linear, and it's a very small part of what's out there in the reality.
Yeah.
And so, although we do some of that here because we want our students to be able to pass the boards, and
Sure.
we need information, and anatomy has value, and some of those things has value.
Yeah.
We ground our work in doing, and so we have students that sometimes want to know how do they get better and what do they need to study, and most of the time the answer is you actually need to practice more. And so it's really nice. It's nice to have you here. It's nice to hear you say that from so far away. That and one of the things I love about reality is it always surfaces in practice. Like we can make guesses on what reality is, but over time, if we'll just practice, the reality shows up. And that's one of those realities that
Yeah.
if you practice, and martial arts is a really good place to look at
Yes.
that the reality of what you know about martial arts and the actual doing of it, those are two different things. And so it's really good to hear you say that.
Yeah.
Yeah, thank you.
And the power of practice is also, it just anchors you again and again in the here and now. 'Cause
It
be
produces this cycle for us. We've noticed the practice produces a cycle of thinking for a moment that I've figured it out. and then that moment being followed up with this humility of I don't know anything.
Yeah.
And that it creates more of that cycling for me at least.
Yeah.
So
Yeah. It's very humbling.
it is, isn't it?
Yeah. But what I also mean, it's like the moment we start touching and people allow themselves to be touched, they enter this here and now space
Right.
from thinking to feeling.
True.
And feeling is always now. And feeling
I like
is a
that.
doorway to just being present with
Wow.
whatever is happening. Even if nothing's happening, nothing is something.
It's true.
So I'm hearing you shift from doing to being. Is that accurate?
Yeah, but I don't skip feeling.
Ah.
It's true feeling. It's like when we're working with people's emotions, like when we touch and there's repressed emotions, conscious or unconscious. At some level, it's gonna open up. It's unavoidable. And what I love very much about the word emotion is that it means movement. And emotion needs its natural movement. Once it gets its movement, whether it's fear or whether it's anger or whether it's emotional pain or whether it's another feeling state, then it becomes a doorway to a deeper sense of being, which has many qualities. It can be peaceful, it can be vitalized, it can be warm hearted, it can be excited. Any kind of essential state can show up once we move through these feeling states. Yeah.
So as a therapist, are you also feeling?
Am I feeling? It's I don't manage not to.
Of course.
But that's also what I meant with walking the talk. How can I work with people if I'm not doing my inner work? I cannot.
Correct.
What I often ask myself with clients is, do I know when someone presents an issue, I just have to ask myself, do I somehow know this in my own experience? Once I know, I have a rapport with them. Then we have a connection, a felt sense connection. And from there, I can move. And from there, they get into this sense of safety. From there, they trust because they know, I know, whether we speak it out or not, they just know that I'm leveling with them and that we are leveled. It works both ways. And I remember, I have to tell again, that when we had a video call some time ago, and John said, "So you're working 40 plus years? How do you do that?" It stayed with me like a koan. I kept asking myself the whole week, "So yeah, how do I do that?" Because that's a very good question. And I was underneath the shower, and that's such a good place for understanding and for insight. And all of a sudden, of course, it's very simple. It's because we're sharing love, and that's inexhaustible. And we're sharing love through touch, through contactful touch, which for me means that it's reciprocal. We share. A client needs me for whatever is burdening them or for whatever has their interest, but I need their presence and their input to be able to work with them. So it works both ways. They learn from me, but I learn from them. So that's nourishing both ways. A client leaves better after a session. I leave better. How beautiful is that? I think I can do this the rest of my life. unless I get sick, but this is not in my hands.
Right.
Yeah.
One of the things that we also do here is we recognize that the current, and the current being the predominant narrative in our culture,
Yeah.
often has control over us in a way.
Yeah.
Or let's say, I'll even be more respectful of that, saying that we often have allowed for there to be a current driven control over us.
Yeah.
And it's particularly predominant and strong in medicine. And one of the things that I've been tasked with here at the school is to claim, to theorize, why are we here? Why am I here? Why am I here at this place in this position?
Mm.
To affect education in our culture. And I think a big part of it is that the narrative that has been built in Western medicine has to be it has to do with the practitioner cannot feel. That to be a good practitioner, I have to not feel. Even in the psychological sciences, it's shocking that it could be there, of all places, even in pediatrics. Some of the things we do to children, it requires the fact that we're even doing it. It requires that medical professional to not feel, because if they were feeling, it wouldn't be doing them. And so, one of the things I love about this movement is fully grounded in touch, and that, from my perspective, if someone were to be primarily responsible for that movement, that's us.
Yeah.
That's those of us that it doesn't have to be just massage therapists. It's got to be people that are dedicated to touch being primary.
Yes.
And there's many ways that we will, I think, run up against the predominant narrative in the culture, and I think we're going to get some significant pushback at some point too. But what I like about this movement is because of its components, requires the practitioner to better themselves. In fact, it's a primary component that and by the way, the bettering of myself is not easy. And it's not, and it could even look like I haven't bettered myself at all, because in the bettering of myself, I'm having to pull all back the curtain that covers up all the stuff that is really ugly.
Yeah.
And what's really cool here at this institute is we're doing that work in our classes. We're doing that work. We're requiring that very early on.
Yeah.
And so what we're seeing here is we're seeing a very advanced practitioner surface really early. And so there's people out there going, we just want a Kekino grad to come join us.
Yeah.
And so the things you're saying they're so helpful.
Yeah.
And so helpful. Thank you.
I'm touched when you're sharing this.
Yeah.
Yeah. Please go
John,
ahead.
may I clarify this movement? How would you describe that?
Yeah. Well, I mean, the podcast is called Touch Revolution. About 20 years ago, I had 2 book idea names. I didn't have a book, by the way. I just had an idea. My personality often kind of starts with the end and works backwards. And so I had Touch Revolution and a book called A Return to Touch. And so I would say that the Touch Revolution is I've been thinking about it lately, and it's totally subjective, but if 100%, meaning that the revolution is complete, we're at about 30% of that revolution, 35. Like, there's work to do, but it's in play. Like, it's already started. And what a touch revolution is this almost epidemic realization that we cannot live and cannot thrive without touch.
I agree.
And that's the reason you're here, is that across the land, to another continent, we've been able to reach out to you and have you teach here. And we used to look for bringing teachers in with diversity, and we're kind of leaning more into teachers that have like-mindedness.
Yeah.
Yeah, I don't know if I answered your question.
No, that's helpful.
Okay.
Thank you.
All right.
In my practice in Holland, this brings it up in me. So for the past years, the last, I think 3, 4, 5 years, I see more and more psychiatrists, psychologists, doctors, all because they realize they're missing out. They start to feel themselves basically uncomfortable.
Yeah.
And I see quite a few coaches. Coaching is a big thing in Holland. Everybody calls himself a coach. And I had a whole group of coaches coming for quite a while, one-on-one. And I experienced him as really emotionally intelligent people. But once we got into touching, the whole perspective changed. It didn't change, it deepened because it got their body. Their felt sense got more and more embodiment.
Mm-hmm.
Yeah, that's what I wanted to say about
That's
this.
funny you bring that up. We've been exploring group work here.
Right.
And so that's most, I was on a podcast a few weeks ago where I was asked, I mentioned us doing group work here.
Yeah, what kind of group
And she
work?
said that she didn't even know that existed. And so, it was nothing wrong with that, but it's so good to hear that you're doing group work. So what group work looks like for us, one of the most notable places that we do there, I'll give you two.
Yeah.
One is the third class in our business class is actually a group healing session. And so when we look at the human body here, we look at it with the idea that the human body is obstructed by some sort of primary restriction at all times, especially if a person's not feeling well. And so, the job of the therapist, and the better the therapist gets better at finding that primary restriction, getting their hands on it, and in that process being able to facilitate some sort of release.
Right.
We started applying that philosophy to a group. And that if you were to look at a group, like let's say a group of coaches, that if they have worked together enough, at some point, a single person will be the primary restriction in that group. It's the person that's holding the group back.
Yes.
And so we have been able to recognize in our classes, so we actually do that work. And there's a lot of somato emotional release in those courses, in that particular class. That's a 4-hour class with multiple therapists in the room to help facilitate this group breakthrough. And it's made a huge difference. But that's what group work looks like with us. We're using somato emotional release, craniosacral therapy, energy work,
right,
lymphatic work. I
Right,
mean,
it's
I
all-
could kind of go on and on.
It is all touch based. What you
It's
do.
all touch based.
Right.
I personally consider touching the energy of a person to be touch, by the way. So just if I'm hands off, but in I am touching them energetically,
Sure.
I still consider that touch.
Sure, me too.
So, and if I can access someone remotely, that's a form of touch. So, in my opinion.
Yeah.
So,
Yeah. In my opinion too,
Yeah.
it's my experience also. But I was also thinking in group work, the group work that we do in Holland, for instance, in the rebalancing school, the Dutch rebalancing school, we incorporate active meditations,
Right.
various forms of active meditations with a build up through breathing, movement, catharsis, expressing before going into silence, because it's still a meditation. So it moves towards silence, but on the way to silence, energizing, embodiment, and release are so helpful to experience silence as silence and not
Right.
as just sitting and thinking, which people would call meditation.
Right.
So we use that. We're using connected breathing, which is a technique. It's more a soft, gentle technique of breathing that helps people move inside their bodies and to the psyche deeply and touch repressed feelings, emotions, memories that are still charged, traumata,
Right.
and have the body release by itself. It just comes by itself. Once it's
Right.
there, it's just releasing because you can't hold it back. And then you move into the rhythm of the breath again, because that's your that the focus is the breathing. The focus is not the release, the focus is the breathing. So it helps you move like a wave through layers of resistance, fear, anger, whatever wants to be released and touched.
Right. When someone releases, do you notice that they, and Marnie, you may weigh in on this too. Do you notice that there's almost an amnesia for the memory? Have you ever experienced that?
And what is an amnesia?
Like they can't remember. They can't remember at all.
Yeah.
Like something that held them back for their whole life.
Yeah.
Like after the session, sometimes they can't even remember that they told me.
Yeah.
Is that's something
Yeah,
you've
it's
seen?
you could call it a kind of a trance state, a different layer of the
Right.
subconscious where the memory is, but it doesn't come to the normal daily consciousness. It doesn't
Right.
come with it.
Right.
But I've learned something about this a lot, but something particular. If the memory doesn't come with the release, sometimes it doesn't come with the release, it's not necessary to dig for it.
Yep.
Better
Yeah.
just to release.
Yes.
If it is needed, it will accompany
Right.
the release. So no need to put
Right.
stress on the mind to have to know it.
My first patient today said, I thought we would work more on my father. I have a lot of issues with him.
Mm.
But that did not come up in session at all. And I said, well, how do you feel about your father right now? And she said, I feel really good about him. And I'm like, let's not bring him up then. It sounds like we're good. So that's funny.
I have this so often with sessions, especially when people come for a whole sequence, that they start to tell me, but I'm asking them, so what can I mean for you today? Is there anything you want to share? Is there anything you want to inquire into the sessions? Yes, I'd like to continue on last sessions. And then I sit there, I go like, oh boy, oh boy. And I just keep silent. I respect it, of course. And I see how the mind just wants to be on this red line and move on. And often it just doesn't happen because it's not relevant. Because once we go inside and we get into the touching and into all these felt sense experiences, it's whatever wants to show up, it will show up.
Mm-hmm.
And it may not necessarily what people want, what they expect,
Right.
what they presented to be inquired into. I have no clue.
Right.
And I think that's my best position, that I don't know. And this not knowing, it is being with open hands. I don't know. And that's the best place for me to come from. It brings brings a type of insecurity with it, but
Right.
I've come to love that insecurity because it tells me the energy has no direction yet. At some point, it will start moving in a certain direction. If I'm allowing myself to feel whatever I'm feeling and hanging in there, it's the best way to be present with people.
Right.
When I feel, they start to feel. That's
Yeah,
where we
that's
have
true.
the, what's the word again? Reciprocal. I don't know.
Reciprocate.
Yeah,
Yeah.
that's reciprocal, huh?
Yeah.
I love that. I find that taking the ego of the therapist out
Yeah.
and taking out my idea of how the session should go, just really allowing spirit.
I tell you something now because it comes immediately to me. I've been with Osho for many years, also when he was alive, and he's not been my savior, but I've been learning so much under his wings. The first thing was, it was a big kick on my ass. I thought someone's going to tell me how to live. He said, I'm there, but you do the work. So it was just a big kick in the ass. And that was the best thing that happened. But then at some point I was there, one of the people that I was doing a group with, a training psychic massage, Saga Priya. She is a really great and sincere person and a very good therapist. And she asked him a question about the ego of the therapist. I don't have the question. I have it. If you want it, I have it. She asked him this question, and then he began saying, don't think in terms of helping people. Think in terms of sharing. And because when you use this helping, it just creates a hierarchy, an unnecessary hierarchy. And when you share, it's like you have your issues, I have my issues. I can help you with some issues because I'm a bit further with that. I've looked at it, I've worked through it. But you may come with stuff that I'm not finished with and I can learn from you. So how it helped me throughout the time I'm working is that I feel free to be very personal with people if it serves them. Because that's a question I have in the back of my mind. If it serves people, I just share how it is for me. Why shouldn't I do that? when I share how it is for me and how I am doing it or not doing it or struggling with it, they relax because we meet on the human level. And how beautiful is that?
That is beautiful.
Yeah, that is beautiful. They live better, I live better.
Well, and again, our culture wants to teach us that silence is a boundary, and that one of
Yeah.
the things that we recognize here is that the boundaries actually set through relationship,
Yeah.
not from the lack of sharing. It's actually established through sharing. That's actually where the boundary is.
Yeah.
And I don't have to shut down to produce a boundary. I can provide a deeper connection to produce a boundary.
Yeah.
And it's yeah, I think we're going to see that more and more.
But you know, the interesting thing about boundaries is also that the boundary is just, it's a stopping point.
Right.
And it's a stopping point and then to reflect. And then maybe the boundary, it remains because it's a full stop.
Right. It serves a purpose.
It serves a
Right.
purpose. And many times it's just like a stepping stone. Once the boundary is respected and reflected,
Right.
we move on and we go deeper.
Absolutely.
Yeah. Yeah.
Amazing.
But we need this felt sense. This is, we come
Will you
back
talk
to the
about
Dutma.
felt sense?
Yeah, what felt sense, just whatever we feel, being in the body in a way that we feel, that we use our senses inwards and outwards, but basically first inwards.
Okay.
Yeah. How do we know how clients are doing, how they are feeling? How do I know? I remember in the school with Byron Katie that she said, "You cannot feel another person." I thought, what? I'm doing this. I can feel other persons. I can feel them.
Right.
But it, it got me
Yeah.
because I respect her and I think she's very clear. So at some point I thought, how do I know what people feel? I know it inside my body.
Mm-hmm.
I know when I just get a little bit, for instance, a little irritable when I'm touching,
Mm-hmm.
I just check, am I irritated? No, I'm not. I'm free. I'm relaxed. I'm open. I'm silent. This is what the body of this person is just transmitting.
Right.
The person is irritated. And then I check, so how do I deal with it? I just wait for the right moment and I ask a question. Is it possible that you're a little bit angry? How are you feeling? What are you feeling in your body? Simply body based questions.
Right.
And then 10 out of 10 times, it's right.
Right.
So I've learned to honor that feeling space inside. That's why I think it's so important that we live in our bodies, because then we know what people are feeling.
Hmm.
And then we need, of course, the counseling skills, the question skills to navigate to them. They need to give the answers. I'm not giving the answers.
Right.
I can just give a hint
Right.
or ask a right question or just hang in there and just feel it until the moment is there just to open my mouth or they all of a sudden start to talk. So it is also necessary as bodywork therapist to hang in spaces of discomfort, hang in there,
Right.
be willing to feel uncomfortable because that's what the situation requires, because it's helpful.
That's good advice. Yeah.
Yeah.
So you're teaching a class this weekend with us.
Yeah.
I have to admit, and this podcast has already been fantastic in my opinion. I'm really enjoying it. Thank you.
Yeah, me too.
But I'm curious what it would be like after this weekend, because I'm getting an idea of where, just in talking with you, I'm getting an idea of where we might go this weekend, and I've had a sense that your classes are maybe a little more ceremony oriented. I don't know if that's the right word.
What do you mean with ceremony?
Okay, let me find another word. That experiential.
Yeah.
Yeah,
I-
that they're not technical.
I can give you a
Yeah.
kind of an idea
Yeah.
about how I'm doing this course, this particular course,
good.
which I've been doing now for I think 15 years, and
Right.
I have a blueprint for the program. Some elements they will be in there always, and depending on the group of people, we may play around and
Right.
be creative. I will be creative. So how we always start is we sit together in the morning for 5 minutes or so. We go inside in silence, and will do a guided meditation inwards towards the area we're working with, the psoas, the hara, the belly, the pelvis area. Also ask people to verbalize what they're feeling, to get the mind aligned with the felt sense and with the feeling. On one of the days, usually day 3, is my experience by now, we need to do a bit of more sharing, but I will see how that runs.
Right.
Then for part of the morning, we will do movement exercises from a system called Okido, which is not being taught anymore because this man, Oki Sensei, he died in 85. And when someone asked him what happens to Okido, he says, then Okido is finished. But when I met Oki, we're getting on a different track now, but
That's
I tell
okay.
you a bit. When I met Oki in 1981, I was cooking for he traveled through the world. I was cooking, and he was such an inspiring man, this Japanese Zen master.
And his first name was
Masahiro Oki.
Okay,
Yeah,
okay, got it.
Masahiro Oki. Yeah, he was a crazy Zen master. But he had this thing called Okido Yoga, and I was from the very first moment I was turned on, and I started teaching within a couple of weeks because I was so excited to do it. And the exercises are light, they're playful. The many exercises are in two psalms, sometimes with the whole group, and we'll be doing that also with this group. But what I like so much about these exercises after all these years is that the body doesn't lie. When we're doing an exercise with, for instance, with falling, or that kind of triggers the falling sensation, the body is very honest in how we react, respond, compensate. So everybody just feels instantly, this is how I do it. I may think differently, but my body is very honest. So we'll do that, and I like very much to introduce one of the active meditations.
Okay.
We'll do that on day 2 or day 3. Maybe we'll do an unwinding session. But it's not an unwinding on the table. It's an unwinding in the room, standing in two psalms. It's very gentle and powerful. And we'll do a lot of touching.
Right.
We'll do very much touching.
That's amazing.
Does this answer your question?
Yeah, absolutely. You are, I'm getting a sense of what the class is like and the style. And again, we so frequently had looked for diversity in our teaching, and we're finding ourselves.
So good for me to hear that.
But we have been finding ourselves. We've been looking more and more for people that are where we are.
Right.
And so we're finding although we are fairly grounded in, anatomy and physiology here, we again, the experience is really important to us. And we understand the 3-dimensional aspect of the human body. We respect that infinitely. And so anytime words like unwinding or following come into play, we feel like we're with the right people.
Right.
And we also recognize that often we do a process in the advanced master level clinic here called resuscitation, where we propose that a person actually doesn't have enough systemic movement to know what's next.
Right.
Like they're in a sense of deprivation. Maybe their system is dire or broken or whatever. And we go about using communication, talking, followed by touch, to restore a higher level of flow so that we have something to follow. I always think of a dry riverbed and trying to figure out where the water would go when there's no water in it. And that's the way I see patients frequently is there's not enough flow to even know what's next. And so we resuscitate them first.
Right.
And then in that resuscitation, we're able to begin to get an idea of what's next. And it's always something, it's not always, but frequently it's something that surprises us. Or it's benign. It's something that's not as big a deal as they thought. Like once they got out of the low vibration state, there's not actually a problem. They didn't have the problem they thought they had.
Because they get into a higher frequency.
They got into
They
a higher
start to
frequency.
feel, and
They start to feel,
move.
right?
Yeah.
So
Ah.
So I am curious, like, what would this podcast look like next Wednesday? I'm just curious. We're not going to do it again because we're going to be doing other things. You're going to be seeing patients here. Michael's going to be out of town, flying around helping other people.
Yeah.
But it'll be fascinating
It'll be fascinating. Yeah.
And we've worked really hard to bring you a group of students this weekend that are ready, that are not going to be surprised, and that are ready. And so have you noticed that you'll have classes that go deeper than other classes?
Of course.
We're trying to bring you a class that's going to go deep.
Yeah.
So
great. I'm willing to go deep wherever it leads to. And what I like very much, and what I'm usually doing the last years with any kind of touch group, is just show how I work. And of course we will do techniques, but basically I'll be showing how I'm working with the body, how I'm working with my voice, with questioning, just whatever works, whatever I think works, and then find out, does it work?
That's true. Yeah. That sounds great.
Yeah.
Okay, I have a question for you. I want to talk about Osho.
Please.
I think it's a good subject. Anytime the world has gotten a hold of a subject and there's been something put out there about a person and then I find somebody that knows them personally, and you've been a student of his for many years. And what I love about a real teacher is you're still a student of his. I watched you. You actually stopped for a moment and held some reverence for him. I watched you, like you literally paused for a moment and gave him a moment of respect when you brought him up.
What else?
What else, right? And so I noticed that, and so I don't want it to go without recognition. So first of all, I want to acknowledge you for holding that kind of reverence for someone else, because reverence, I'm coming to learn, especially with my children, is that we have a lot of kids that are being taught they have no reverence for their teacher, nor does their teacher deserve reverence. And so one of the things we're recognizing with our children is that if they have reverence for us, then they'll always seek my teaching. And if they have reverence for their teachers, then they'll always seek their teaching as well.
Yeah.
And kind of Waldorf, kind of philosophy, maybe Marie Montessori, or combined.
Yeah.
But first of all, I appreciate that you stopped and you gave him a nod, like for a moment. But I have Netflix and I watched the documentary about Osho.
So did I, and that was also true.
Yeah,
but we didn't. At that time, I was in America, 1983, 84, 85, each year for 2 to 2.5 months.
Right.
All this stuff was happening. We had no clue. I was not there for that. I was there for being with Osho and doing the groups and the meditation and being in this communal environment, which was just mind-blowing. Mind-blowing. Everybody
life-changing. I've actually met
life-changing.
Yeah, I've met a lot of his followers. They are incredible people.
Yeah, it changed my life until this moment.
Yeah.
Like, he's not as a person, but he's always with me. When I'm in my session room and giving a session and I get to a point that this is right what I'm doing, can I ask this? I look at this picture and he doesn't answer me, but I know the answer.
You experience the answer.
I just know because I feel mirrored.
Yeah.
It's just a very clean mirror.
Yeah.
As clean as it can be.
That's great. Anything else you want to say about that? Anything else you got to say?
Like rebalancing, which I've been doing since 1986, it's his creation. He had a group of very gifted body workers around him, and some of them are still active in their 70s. And they all got kind of stuck in their own method. And they went to him with this question, what to do now?
Right.
And he was simple with it, as he could be so simple. He said, teach each other your technique, integrate it, and call it rebalancing, and let it be like an umbrella. Anything new fits under the umbrella
of rebalancing.
Yeah, rebalancing.
Yeah.
It's a beautiful word, rebalancing. Many people,
chicken skin.
yeah. Many people, clients, they think rebalance. Oh, I'm going to get a good balance now. But what we don't tell them, it's usually getting off your existing balance, which is disturbing or traumatized,
Right.
so that you get into unknown territory
Right.
and hoe zeg je dat toch? Out of your comfort zone, so that
Yeah.
a new balance can start emerging through inquiry, through going inside, through reflection, through working with your feelings and emotions, through living a more truthful and honest life.
Right.
So I think that's more true to the word.
That's good.
To give it, we call it to give it hands and feet.
Yeah.
You need to first be unbalanced to know what balance is and what a
Right.
more healthy balance is.
Yeah, the destabilization part of the process is necessary.
Yeah,
Because the only way
absolutely.
you can be stable is to be destabilized.
Yeah, and to know what it is like. And
When I do a lot of visceral work, patients are often like, "Man, my stomach feels so loose," and I'm like, "That's a good start, you know.
yeah,
Let's call loose 0,
yeah,
and like we want you to have access to 0 and 10,
yeah.
and everything in between." So, um, let's see. I had another question. I am kind of jumping back. The 3 principles from Masahiro. Am I saying his name right?
Masahiro Oki.
Yeah.
Yeah.
Yeah. Um, do you have do you know those principles?
Just
Yeah.
please tell
So,
them.
in order to improve ability to maintain psychological balance, it's important to regulate and enhance our body's functions.
Yeah.
Suitable diet, sensibility through breathing, those things. So, what struck me about this is how basic it is.
Yeah.
And it kind of strikes me about all of the work is it's oddly basic.
Yeah.
And what it made me think of when I was reading about his work is that all of us keep finding ourselves when we're practicing a lot, we keep finding ourselves back in this basic reality that the complexity of longevity is not longevity.
No.
When the word complex is involved, it's actually not longevity.
No.
And so when I looked through these, and improving mental stability, and there's stuff here about it, but improve our adaptability, our ability to withstand the ebb and flow of being existent, those kinds of things. Like these are all pretty basic.
Yeah. He was a very basic. He was a very gutsy guy.
Yeah.
Very basic.
Is he still living?
No. He died in 1985.
It's been a while. Okay.
And he knew, like a couple of years before he died, he already said, if you want to learn, please be fast, because I won't stay long. He just knew.
What an incredible warning.
He was really, wow. He was quite, and like, I can tell you some funny words, some funny things he said, because his English, it was not so good. But when he was doing his question and answer sessions, which he would do during his trainings, he would have these short quotes because his English was not so good, but they've always stuck with me. Like he would say, difficult people, thank you. That's really wide when you get into that. Difficult people, thank you.
Michael and I spend a lot of time together supporting each other in growth and development. And most of you can't see Michael. Michael's running the podcast, and so I can already tell he and I are going to be like, difficult people, thank you. We're going to do that. Start a trend in his honor.
And I tell you another story. This, because I was there when he did this. This was in the early 80s. There was this group of hardcore feminist women. They were in this training, which was beautiful. They were there.
Yeah.
And they had questions about women and men, which they were quite against. And he was so provocative. He said, you want to know about women? You ask me. I had 4,000 women. I wrote book. I know everything. He just knew how to get them pissed.
Yeah.
Because that's what they were. They were pissed, basically.
Right.
And then
it was a good place to do some work.
And then it was a good place to do some work. Right. Then he said, now men lay down, women hold men, and men fight. So he just channeled the energy. He gave the women the power, And the
Mm.
man had to fight himself free in a playful exercise.
Right.
And the whole thing was clear.
Wow.
He was genius.
That is genius.
Yeah.
Wow.
That's amazing. I guess I'm curious, were they feminist when they were done?
I don't know. I haven't kept.
Curious. Like where would that even land? Would you have to you might question yourself on even who you are through. I mean, people do that all
Well-
the time here in bodywork. Don't you think people, when you work with people, don't you think they start to question the assertions they had about life?
Oh yes, of course they
yeah,
should.
it changes because
And if they don't,
it's
I
like paradigm
will-
shifting, right?
Yes, of course.
Yeah,
They need to. We all need to question that because they're
Right.
just assumptions.
yeah.
And as soon as
So
we can see that it's an assumption, we know we believe something, and we can check whether it's true or not.
right. Do you think that just check, like, you think that the way we speak and what we say and the energy we carry in our words kind of reflects our reality?
Absolutely.
What
No
about
doubt.
what about our physical body? What about the map? Do you think it also
Okay.
reflects?
Once we get in touch with, I keep coming back to once we live in our body, yes.
Mm.
And from that space, from that perspective, we know that people's bodies or people's energy
Mm-hmm.
reflect that. Yes.
Right, of course.
Otherwise,
Right,
because people can have this great body, great posture, but they not necessarily live in that.
right.
Do you understand? You get what I
Yeah,
mean?
yeah. Got it.
So it starts with me. Am I being present? When I'm present, there's a fair chance that I can sense what people's body reflect. There's a
Right.
good chance. How do I find out? Trusting that I'm feeling something right instead of questioning, am I feeling it wrong? And if possible, asking,
Yeah,
checking.
Yeah.
On the street, I wouldn't do that.
right.
But in a session room, I would definitely do that.
Yeah. What do you think, Marty?
I think absolutely that the words we speak, inner and external, the words we think and the words we speak aloud, our body absolutely reflects.
Yeah.
Yeah. So if we continue to tell my knee that my knee hurts, it's probably going to continue to hurt.
Right.
But if I can create a different paradigm, well, I'm coming to see you, John, to help my knee.
Right.
You'll say, well, really, who's holding you back in the world? Or
Right.
what does that knee want to tell you?
Oh, right. Yeah.
Yeah. And I find that people, I'm asking them to listen to their bodies rather than
Do they do it?
often when they're in
Can
session.
they?
Well, we have to teach them how.
Yeah, that's
Right.
that's a big piece of our work is to teach them to learn to listen to their bodies.
Right.
Many people I see, they can't do that yet.
No.
Right.
But somehow the deepest healthy part of them calls them to your and my practice, the part that knows.
Right.
That calls them. It may be through pain and through a fixed mindset, but it's the deeper healthy part that calls them to do something about it.
Yes.
Hmm.
Yes.
Huh?
So what do you think of you've been doing this 41 years, like, have you seen were there time periods where your work wasn't accepted very well in comparison to now?
Where I wasn't accepted
Yeah.
very well.
Yeah, as a body worker.
Oh no.
You've always found acceptance.
I've basically done my thing, and
Mhm.
I didn't bother. I have never bothered out what people would think about me.
That's amazing.
I didn't bother. I just did my thing because I just knew this is what I have to do.
Right.
I'm not so much a mission person, but if I have a mission, this is what I have to do. How do I know? Because I'm still doing it.
Right.
And I'm still, every day I'm switched on.
Yeah.
The light just starts burning when I'm with people.
Yeah.
That's how I know that I have to do this.
It's amazing.
Yeah.
I'll work on that this weekend for
Yeah.
me.
Yeah.
That's if you're already there, and then maybe you can help me get up there. That would be great. That'd be great. I'll work on that.
But it doesn't mean that I'm always thrilled to do it. Of course, I'm human as well. So if someone comes at 8 o'clock in the morning and I had a late night and a fight with my wife or one of my sons who has his moods, I'm not necessarily, and I look at my agenda and I think, oh no, not this person. And here they are at 8 o'clock. You know this?
Right. Yeah.
And here they are at 8 o'clock, and I'm a bit ambivalent, like, okay, am I gonna make it? And I open the door, and there's this person, and they're like, I left home at 6 to be here, and I go, it's just gone.
Yeah.
I left home at 6 to be here. I think, oh, great.
Do you think? I have a thought about it, but let's see what you think. Do you think that's a really important part of your own training? Is having to go from not ready to being ready?
Yeah,
Yeah.
yeah.
I've noticed that.
It's-
Like I'm pressed to teach a lot of people here lately, and one of the things I've noticed is that that's actually a really important part. Is not always being ready. It's getting ready regardless. And,
Yeah,
you know,
that's
and there's some sort of learning that happens
Yeah,
in that spot.
absolutely. Yeah.
Yeah.
It needs acknowledgement.
Yeah.
That's the beginning point is, are we willing to be where we are
Right.
and move from there if it wants to move?
Yeah.
And with groups, I think sometimes it's a bit trickier, but are we willing just to acknowledge, well, my energy is a bit low. I remember some group leaders that they would really, just because something strong was happening for them in their group, they would just expose themselves because they couldn't teach. It was in their way, and they
Right.
would just open up and share
Right.
and cry and fall apart and be taken care of by the group. And then after some time, they would get up and say, okay, now I'm ready to teach.
Wow.
I
Wow.
felt so like, whoa,
Right.
how can you do that? Like, no concepts about the role,
Right.
but just being authentic,
Being where you are.
because
Yeah.
it was too strong to step over it.
Yeah.
What
Yeah.
a way to be human.
Yeah, quite.
Go ahead.
I have a question.
Yeah, please.
So, in our early training, we talk a lot about maintaining professional relationships.
Yes.
And there's this risk of transference, which is
Yeah.
where the client develops feelings or idolizes the therapist.
Yeah.
So, as we start to share ourselves, we're more intimate, if we will. How do you?
I tell you.
Yeah.
How can we not do? How can we do it if it's not intimate?
Right. Exactly.
I can't.
Exactly.
And I don't.
Mm.
I don't want to do it if it's not intimate. But with this, with the healthy awareness, the felt sense awareness, that some transference is happening, and I think that is necessary for the client to establish this relationship. They need to do that. Why do they need to do it? Because they're doing it. There is a need or a longing to have this intimate relationship. And am I willing to have that intimate relationship with them?
Mm.
Sure, with a healthy sense of my position and my boundaries. Yes,
Got
of
it.
course. Yeah.
Got it. So the way you stay in the professional role, for instance, is having healthy boundaries.
Yes, of
Yeah, got
course.
it.
If that is needed, of course.
Got it.
Yeah.
Mm.
But also from my side, from the therapist side, also we have our trips with clients. We have our energy halls where we start to need them.
Mm.
If I have that, what helps me is just to notice that I'm going out. I get overly open. I get this tendency to get overly open, and I go like, okay, just take a deep breath. Let your energy go, but don't actualize it.
Right.
Just be there and be aware that, okay, this person owes something that I don't own.
Mm.
Work to do.
Work to do.
On the spot.
Right.
Nowhere else. Just
Right.
on the spot. Just
Right.
It's like switching,
Mhm.
switching the button.
Yeah.
And not denying it and not suppressing it, but just breathing with it.
Mm.
We in our business class, we're the competencies, meaning the required teaching.
Yeah.
Well, it's not required. It's ideal teaching if you want your students to pass the boards.
Yeah.
There's something that we teach around transference and countertransference.
We do it in Holland also.
So you know. But a lot of students come in thinking that both of those things need to be stopped. And
Yeah.
so we teach it as a resource.
Yes.
That this is actually a resource. And I think we'll lean in even heavier on that. Like there's nothing wrong with this unless you get locked into one of them exclusively.
Yes. That's
And
what I was
so,
sharing.
yeah. And so there's this kind of delicate balance, and it's actually where all of the essence of the work is
Yeah.
in this balancing of transference and countertransference.
Yes.
So
That's where it gets juicy.
that's where it gets juicy. So we're going to take a quick break,
Okay.
and we'll be right back.
Right.
Thanks.
Thank you.
Thank you.
We so we're back. We had it was a nice break. That was good. Had good things happen to break. I don't remember what we were going to talk about, so that's we're just going to have to roll with it. Kind
So
of
we're
organic.
back in and not knowing.
Right. We're back in the same place.
Well, should I ask a question?
Yeah, go for it.
Can we clarify or maybe succinctly describe what it is that we do to someone that doesn't know us?
Well, yeah,
Yes.
Wilko, let's
Yes.
hear what you do. That's for sure.
Reflect on that a bit. So when my window cleaner comes to my house, when he came to my house, he said, "So what are you doing?" So I thought, how am I going to explain that? How can I make it so simple that he understands it? He's not stupid, but he has no clue. So I told him, what I do is I touch people with my hands in a way that they learn to feel again. He understood that. I said, and what often happens is that people start to feel their tensions. They have tension. Sometimes they get angry. Sometimes they get sad. Sometimes they become aware that they have a shallow breathing, that they're holding their breath. They just start to become aware of many things that they've never been aware of. And contactful touch is a very good medium to get people there. And then he said to me, "Oh, I need that too." And then I knew he understands it.
Right.
Yes.
So the simplicity of the words, I think that's the best thing to do. No complexity.
I love that. Thank
Yeah.
you.
And then you usually notice if someone's interested or they just switch off.
Do you think they switch off because they're not ready to
Yeah.
face what's inside?
It just triggers a mindset. Oh, that's not for me.
Gotcha.
Too close. Oh, resistance.
Right.
Which they won't notice as resistance, but they just switch off.
I have a question. Like, that's really simple, and I like that. Could you make it more simple?
I'll try.
That'd be fun. Let's see.
Trying is effort, and effort gives tension. Milton Traeger. Don't try, because trying is effort, and effort gives tension.
Oh man. Okay.
How simple can we make it, huh? So, I would say, make people live in their bodies again in a more conscious way, but that sounds much more complex.
It's pretty simple.
Yeah?
Yeah, it's still good.
Okay.
It's not so much to produce more simplicity in the communication, but just to come at it in different angles.
Right.
For me, like, I haven't explained what I do simply ever. I've always spoken where I can see people, their eyes are rolling back in their head, like, what the hell is he talking about? And so a lot of times I find myself giving them examples. I talk about garden hoses a lot, and those kinds of things, and that in those examples there's some simplicity that they accept.
Yeah.
But I'm challenged, and I accept that challenge and listen to the simplicity of what you have to say.
Because what comes to me now is I could tell someone, most people only live in their head, and they go, because they know.
Yeah.
They say, I help them with touch to become aware that underneath their head there is a 6-inch body, which is only functional for them.
Right.
But you can also live more in it and enjoy life.
Right.
That's another way of expressing it.
Yeah,
And that many
beautiful.
people come to me because, I'm living in my head all the time.
Right.
I say, well, I want to live more in my body. And I tell them, well, but you have this a total misconception. Your head and your body. Just look down and look at this
It's right there.
connection. It's just same thing.
Right.
Your head is your body. It's part of your body.
Yeah, it's part, but not really. It's not, because if we think it's part of the body, we would in that communication we would be saying that there's parts. There's
Okay.
not,
Yeah,
and
of course.
and
Yeah,
there's
it's
not
connect. Let's
there's
say
not.
it's connected,
It is one thing woven, maybe woven. Could you,
interwoven.
yeah, like maybe
Yeah.
woven. It's hard when we start using language. We almost
Yes.
have to like disclaim the speaking by
Yes.
going, no matter how much I express in language that this
Yeah.
is all one thing, it's
Yeah.
more one thing than that.
Yeah.
And then we can talk freely.
Yes. Yes.
But that's the challenge with language.
I get it.
that
Yeah.
It starts to pull it apart, right?
Yeah.
And as if it's
Yes.
apart, and it's not.
And it's not. No.
Yeah,
Because the body is the mind.
it is.
It's.
Isn't that fascinating?
It's
And
totally.
that's the reason you would show up here with a SOAS class.
Yeah.
And actually, you're here to teach us how the SOAS is your mind. Maybe.
When I hear SOAS, and it's been a struggle for me, not anymore, but for a while, for quite a while, teaching a SOAS class, I would go, oh, that's a bit narrow,
Right.
because that's these muscles and all these connections, and it would narrow me up. And I thought, that's not a good place
Right.
to come from, and it's just too narrow a vision to work with, because it creates an expectation that I cannot facilitate, because that's not my way of looking, and not my way of living. So then I will do this in the class also. I will tell people everything is connected to everything. So when we work the SOAS, it has all its physical connections. So we can't deny any of that. So we
Right.
will work the whole. We will need to envision and facilitate the whole system, the whole physical system, including the breath, including the mind, including our thinking, including the feelings. If it happens, emotions, our energy, we cannot exclude anything.
Right.
And still we're working with the SOAS
Yeah.
as a physical component of a bigger energetic and physical whole. How is that?
Yeah. Oh, yeah. It's rich. Yeah, we'll be pulling that out and reading it and living by it. So thank
as
you.
good as we can, yeah.
Yeah. Thank you.
Why did you choose the SOAS for the first class?
Well, I didn't choose it. I was asked.
Speak more to that.
Yeah. I was asked, I think it's about 15 years ago in Holland. There's this craniosacral academy, Piercement Craniosacral Academy. And the man has become a very good friend of mine, a very dear friend. He's a very good cranio practitioner. He's living in Seattle now. And the person who was teaching the SOAS class, he got a heart attack. So he needed some replacement. And I was recommended through people. So we had a talk. We met. I didn't know him. He didn't know me. But he knew I was doing rebalancing. And he had been doing rebalancing himself also, but it just wasn't his thing. Cranio was his thing. So he knew that this kind of more dynamic body work, that's what I want in my cranio school. So people can widen their view and they get a more broad experience and get more tools in their backpack to deal with people, to work with people. So they called it in the beginning deep muscle work. And I thought, doesn't cover the matter. So I thought, let's call it SOAS release. And I thought, well, that's more close to reality, to my reality. It still is. But now I would prefer to call it SOAS release and Hara awareness, so that we include the bigger whole, the physical whole, but also the energetic whole and the connection with the belly, the pelvis, and our energetic and gravity center.
Yes.
And our connection with the earth and the connection with the sky.
Would you also call it rebalancing?
I would love to.
Why not?
But it's, why? Well, I'm fine with it the way it is. I would call it rebalancing and then this aspect of rebalancing.
Beautiful.
Yeah.
Yeah.
Because in rebalancing, we cover so much more.
Right.
Yeah.
Thank you.
The nice thing about the name is it's familiar.
Yeah.
And so it is a word that in our profession, at least, it's familiar. It may not be familiar with everyone, but in our profession, it's familiar.
Yes.
Just it begins with a P. So even that, it doesn't begin with an S. It begins with a P, and so everybody immediately remembers it for that, especially as students.
Yes.
And then they go, yeah, oh yeah, the SOAS, like it's almost famous.
It is.
And so from that place, I'm able to at least create an audience.
Yes.
They can hear it, and then we go, here's what it is that you thought it was, and here's all of the ways that it's actually not that.
Exactly.
So it's a good place. I wrestled with it at first.
Yeah.
Because we have people that think psoas is a hip flexor. They're thinking of it that way, and I'm like, that's not accurate. And it's small. It's way more than that. So, and we've experienced that here. So we're glad to have you here to teach some of these things we've already experienced. We've already experienced it as the way it is, and we know that you're going to take us much further than that. So we appreciate it. But yeah.
Could you, I have a definition of SOAS, but I would like to hear why you think it's big.
Well, I think it's big because the left lower belly, from my perspective, is the most common primary obstruction in my practice.
Mm-hmm.
And I've been practicing 32 years, maybe 50,000, 60,000 appointments. And it's almost, I can almost depend on it.
Yeah.
Like, especially if someone's in a lower vibration state, that the lower left belly is going to be clogged, for lack of a better word, lymphatically, energetically, and the left psoas is going to be in spasm. Mm-hmm. In spasm, meaning it's contracting without needing to contract. Yeah. And so that's why it's significant to me. Mm-hmm. And conventional wisdom would be, then you've got to work that side, and then you got to work the other side equally to create balance. And we know that's not true. Yeah. So it immediately provides us an opening for teaching, like immediate, because it's such a good example of our lack of bilateralness. Mm-hmm. So we can immediately go that this is so important that we release psoas left side and leave the other side alone. In my opinion.
Yeah.
Okay, thank you.
So
automatically, with many people, when I work the belly, automatically I go to the left side. Mm-hmm. Automatically.
And there it is.
Me too.
And there it is.
Chicken skin.
Yeah. But often, now we're talking about this, I've also started to call the SOAS the physical alarm system.
Wow. Nice.
It just came to me. Because I think I used to be confused. So fight, flight, freeze.
Right.
Very simple reflexes. And I used to think, so this is all in the SOAS. But it's not true. Sometimes it's true. Often it's not true. It's just, it's in the subconscious. And when there is a trigger, then it gets reflected, for instance, in the SOAS.
Right. What about chronic triggering? That it would, because that's kind of how I look at it, is that when someone's chronically triggered, then they end up.
Sure.
Like you can uncover their belly and you can literally see the psoas. It's in contraction.
Yeah, of course.
Yeah.
But it doesn't always solve the problem.
No.
Because they need to address the triggers.
Absolutely.
It's unavoidable to take the whole package, to unpack the whole package.
Right.
Right. So they'll never find the physical relief of symptoms if they don't address the triggers and the emotional, right?
I wouldn't make it a law, but often not.
Never, maybe never permanently.
No, never permanently.
Right.
Right.
If I'm very honest about myself, if I'm honest about fear, after so much work throughout the years, I can still get triggered. And at least it takes 1/10 of a second and I feel it.
Right.
And that's enough. Because I get interested. That's the best thing I can get. I get interested.
Right.
And I get inquisitive. And I start to inquire. And the best thing I can do is not wanting to get rid of it. No matter how much I want to get rid of it, hang in there. That's the best thing I can do.
Yeah.
So that also brings me to the point, to another thing, and that is trying to fix people. I'm not trying to fix people. And yet, it often stuff gets fixed.
Right.
Mm.
Yeah.
I'm not there to heal people, and often healing happens. And I think that's so. It's kind of a mystery, huh?
Mm.
Because we don't impose. At least I don't impose myself on people that something has to change. But the best thing I can do is get interested, touch, ask questions, have them go inside, have them verbalize what they're feeling, have them feel whatever they're feeling, have them move through whatever is relevant for them to move through and get into a better place. And healing has happened, not because I did the work, because they did the work.
Yes. Yes. We might call
And
that neutrality on the part of the therapist.
okay, yeah, that's a
It's,
nice word.
it's
Yeah,
not my job to decide which way it goes. I just hold space.
yeah,
Is that?
hold space and give direction, of course,
Mhm.
and be gentle and sometimes be firm.
Right.
It just depends on the person
Mm.
and how it comes.
What's
I mean,
needed
I,
that
I
day.
always think of, I find myself often with patients reminding them that that I couldn't have done it without them.
yes.
And then they're
Yes.
like, oh, that's true. And I go, but like the only truth we know is you actually could have done it without me.
Whoa.
Now, you might have needed somebody, but it didn't have to include me.
Yeah.
But the only person we know that had to be here was you.
Yeah.
And so it's reassuring to them, especially when they begin to think that something external to them
Yeah.
was the person that held the agency in the matter.
Yeah.
And I'm like, no, you actually hold full agency.
Yeah.
And so we're more of like co-agents,
Yeah.
maybe facilitating. Maybe sometimes we're just the person that believes in them temporarily enough until they can believe in themselves.
Mm.
You know, or we see a
Mhm.
possibility maybe that they see,
Yeah.
and we'll hold the space for that,
Yeah.
and maybe recruit their physical condition to mirror that.
Yeah.
You know,
And it's also my experience that most people, whatever they come up with, they've been alone with it.
right?
They've been alone with it. So somebody.
You mean it's not new?
No,
No,
they've been
they've
alone. They
they
didn't
had
have.
Alone,
no, they
alone.
had
Okay, I thought you said
they've been
alone.
they've
Yeah.
been alone with that,
Right,
and they need someone to be with them,
right,
so they're not alone with it.
Yes.
So that then they
right.
can work with it, because in the alone space there's a limitation, especially on childhood level.
Yeah, that's
If
true.
we go there, this alone space, it's undoable for them to expand,
Right,
because in the child, we called it kid consciousness, the child consciousness, it's this realm beyond the contraction, is they cannot go there.
Hmm.
They need a parent,
right.
or they need someone to hold that space so that they can grow from this child space to a little bit more maturity. But they need someone for that.
Yeah,
You get what I mean?
I get it very much. I think. Let me kind of reflect back to you. I had a chiropractor that came to me recently wanting to know that they were doing the same techniques as we were. Why are they not getting the same results? And they were not upset. And I said,
Yeah.
you're not with them enough.
Yeah.
Or you're in an environment that's not where you're not able to be present enough
Yeah.
to produce the result.
Yeah.
And so I said, I've been in their environment. I said, your patients feel alone.
Yeah. Huh.
And so is that,
That's
yeah, yeah.
great.
And
That's
so,
very reflective.
and so they said, we'll just refer to you. And I'm like, all right, that's cool.
But that's reality.
It is the reality. If you
Yeah.
want to produce this response, you've got to open up time. There's
Yeah.
got to be time.
Yeah.
We call it, it's very cliche, we call it touch time here.
Oh yeah, I call it quality time.
Quality time. There you
Yes.
go. That's cool. Quality touch time.
Yeah,
There you
quality
go.
touch time.
There you go.
We've
But
got-
that's an important aspect of
Yeah,
healing.
yeah, absolutely.
And people are under touch. Something I've talked about on other podcasts is that we are when we're born, however we go about being born, and then we start to be parented, however that goes.
Yeah.
But the natural state of being born is followed by, unless there's some sort of abusive situation, the
Yeah.
natural state of parenting is very touch oriented.
Yeah.
It's not a natural thought state; it's biological,
Yeah.
and biologically compelled to touch. I was laying behind my wife this morning while she was breastfeeding. I was reaching around, and she reached over to touch the baby. My hand was already there, and it made me think of that. Like she was very naturally going to touch the baby who's breastfeeding.
Yeah.
And I had very naturally already had my hand on her head,
Yeah.
which, with that being said, somewhere along the line, we take touch out.
Yeah.
We begin to, it's not that we just take it out, that we begin to discount its value
Yeah.
and its need to be primary. And so much like here at Kekino Institute of Healing, so much of what we're after here, I mean, we need to be successful here to thrive, but that's not what we're after here. We're wanting
No.
to return touch to the public,
Yeah.
not as just the
No.
act of touching, but the value of it being
Yeah.
held, so that when when someone goes about what's wrong here and how do I solve it, they don't think, well, let me go down a list of diagnostic processes.
Uh-huh.
But why don't I receive some touch and see where I am then? Because if you look back to childhood, and if my little 5-year-old comes to me and he's really upset about something, when I'm done connecting with him and touching him, almost 100% of the time, he doesn't even remember what he's upset about.
No.
And the value of that extends into adulthood, but yet that extension is often interrupted by our culture.
Yeah.
And so, kind of the hill we are to die on here is this kind of touch revolution. We're bringing it back. We're an aspect of that. You've been bringing it back for many years. So, yeah. Does that make sense?
Yeah, it makes total sense. I just have to share, because I remember Osho was telling about touches. Touch is a forgotten language.
It is a forgotten
and we
language.
need to learn to speak that language again.
Yes.
Yeah.
And notice how accurate it is. Honestly, language is like speaking. It's actually pretty inaccurate.
Yeah.
And the more we speak, something I need to always remember, the more I speak, the more inaccurate I become. And I notice like you frequently fall into spaces of silence, which is a really good reminder to me. Yeah.
And I breathe.
And you breathe. And so I appreciate that. I'm gonna learn a lot from you while you're here.
Oh wow.
And
Thanks.
and likely learn a lot from you when you're not here.
All right.
And so I'm recognizing how difficult language is.
Yeah.
Because the only way we could speak accurately about something is to preface it with the disclaimer of that this is inaccurate.
Yeah. It comes to me now. Speaking has never been an easy thing for me. Never.
Really?
No, I tell you why. Because my father, my mother, they both quite consciously were in the Second World War. My father, at age 15, he knocked out one guy from the Germans at age 15 because he was after the women, after the girls in the village.
Right.
And then at night he got the message, you have to get out because the SS,
Right. Sure.
they're after you. They want you.
Right.
So at age 15, on his bicycle without lights, he fled where he was living. And he made it, and he was in the resistance very early on, and then he had to fight in Indonesia afterwards. So he was in wartime for 9 years. And this whole generation, it's called the silent generation.
Right.
Why? Because keeping quiet helped them to survive. But they transmitted that to their children. So I am first generation from the silent generation.
Right.
So talking, there would be talking, but the real talking, no. So I didn't learn to speak. But when I'm called to, like now, like when I'm called to speak reality, truth, what we're doing, then I can talk.
Yeah.
Because it's not conversation. It's really sharing.
Right.
And sharing, I love to do.
Yeah. That's true.
Yeah.
Very good. We've enjoyed sharing with you.
Yeah.
Yeah. Absolutely.
Both ways.
So you mentioned something earlier. You mentioned working with anger as a big part of your practice.
It's been a very big part of my own process.
Right.
To first of all, to discover that I had this emotion inside me, I had no clue. And once I found out, I just knew that I have to work with this. So I did a lot of intense, cathartic work with that.
Osho's practice does a lot with
around
anger.
him. There were There were really very skilled therapists that created really powerful group situations,
Right.
very magnificent.
Yeah.
No matter where you were, you would come out and
Right.
you would touch the matter to the core, to the bone.
Yeah.
So that gave me so much freedom just to deal with it as long as it was needed until I felt like, okay, I've done it. I've
Right.
done this work. Now I know what anger is. When I'm angry, I can do it. I feel it. I
Right.
know it. I can acknowledge it. I can express it if needed. And I noticed in Holland, where I was working, that anger is for so many people, it's such a big issue. Sadness is fine. Emotional pain is fine. Many feelings, they're fine because there's still some sense of connection. And on the childhood level, it gives empathy. But anger, it puts children apart.
Yeah.
It puts, at least, it happens very much. So anger is more in this. It makes children. They. How do I say that? Is they take a stand alone.
Mm-hmm.
They taking on young age with anger an autonomous position,
Mm-hmm.
which in very many families is just a danger zone for them.
Right.
A danger zone for them. So that brought me to the idea to create a process of working with anger.
Right.
And I did that. I've been doing this now, I think, almost over 15, maybe even longer, 15
Right.
years. I do it once or twice a year, twice a year. And it's a 3-day process, 3 days spread over 3 weeks or a month, one day, where we do intense work with active meditations, inquiry, intelligent questions, and just getting into the questions, into the truth of your answers, your experience, quite a bit of catharsis just to release the repressed burden. Group sharings, there's some group interaction as well. There I do some theory with them, but more like plein air. It's like, what is the word for plein air? It's like including the group
Right.
in the theory, including them. I tell them about me and how is that for you and who else knows this. So I include the group so it starts to live in the group with the question. It's really great. And then they get simple homework, very simple homework, just for these 3 weeks or a month, just to have a magnifying glass on their issues with anger. Just get a magnifying glass, be silent with it once a day, and then write down. And then we continue with that on day 2. They get some new homework, and we continue that on day 3. And the feedback that I've been getting is that it just starts to become an alive thing in their life. And I think that's the best we can do. Make
Right.
it alive, make it more conscious, and also give them a sense of responsibility. It's your anger when it's there. There's nothing wrong with it. It's empowering when you know how to use it. And when you have a lot of repressed anger, better to throw it out so that it becomes more natural.
Right.
Mm.
Yeah.
Thank you for sharing that.
And also, but also in sessions, it just depends. That's like when I'm touching someone and I get this sensation of getting irritable or something angry, and I check out with the person and they say, yes, I'm angry. Then I could ask them, so on a scale of 1 to 10, how angry do you feel?
Mm-hmm.
It gives me the information. It gives them the information as well. It could be it's 12 on a scale to 10. Then I know I'm not going to keep touching from there. Something else is needed because touching, there's too much active.
Right.
There's too much toxicity
You mean
already.
if someone's at 12, touching is too much?
Touching does
Yeah.
it won't work them. It won't
Right.
serve them because
Right.
it's too much active.
Yeah.
So then I have some working structures where I have them off the table. Check out with them whom is it that you're angry with?
Right.
Whom is it? Then put down a pillow. Just visualize the person there. Who is it? And then have this what do you call it? Boxing thing.
Right.
Huh?
Right.
And have a baseball bat, something like that,
Right.
something that they can use their physical force.
Right.
And closing their eyes And then if you feel free just to say anything, the raw version, just to be nasty, because that's where your truth,
Right.
that's where the truth of the emotion sits.
Mhm.
If you feel free to express that, what do you want to say this person? And then use the bet just to
Mm.
bring force in it and to bring your body into it so the repressed anger can get out and you can empower yourself.
Right.
And then go ahead, be my guest. I'm at ease, please.
Hmm.
It's just so powerful and it's so simple.
Right.
And it's often very frightening for people. That's where they touch the layer of fear because it cannot be, I cannot say this, there may be repercussions, all these childhood stuff
Right.
may come up, or if there's been an abuser, the abuser has overpowered them. So all this stuff then starts to surface. And then first I address the fear. Of course,
Right.
that needs to be addressed also. But we'll get down to the anger.
Yeah.
Because that's where they start to get liberated and empowered.
Right.
What helped me there is that I done that work extensively and intensively. I know how it is to do that and how difficult it is to do that and how liberating it is.
Mm.
And if it's
Yeah.
needed, I'll do it again.
Mm-hmm.
Right.
It's just a
So
technique.
you're challenging them or providing an environment for them to be somewhere you already are.
Yes.
Yeah.
I'm providing the environment. I'm challenging them, but I'm not pushing them to do it.
Right.
That's up to them.
Right. Yeah.
And not as that's up to them. No, it's their space.
No, I got it.
If they can
Yeah.
go there, I'm very willing to help them through.
Right.
If it's too frightening, too scary, then we inquire into what's happening.
And I think I'm right, but you never feel sorry for them, do you?
No,
Uh,
I'm
I-
happy for them.
I had a client that said, "I think I come here and talk to you because you never feel sorry for me. You're the only." She was dying.
Oh, that's beautiful.
She was
That's
dying. She
someone-
said, "You don't feel sorry for me." She goes, "And you know I'm dying, right?" And I'm like, "I'm pretty clear that you're going to be gone here pretty soon."
Yeah,
And she said, "You don't feel sorry for me." She goes, "It's the reason I'm here."
yeah.
Mm.
No, I never feel sorry for people.
And then the other one that I hear is that I'm here because you have to listen to me. So, and so I'm like, that's true. That's true, right? Right.
Yeah,
Nice. Sometimes people just need to talk. You know, anger, in our local bodywork area, people talk about the liver a lot. And I often, and I am one of those,
Yeah.
because I see a stressed out liver a lot. But I'm also one of those that, you know, I also see stressed out left psoases. And so I'm like, what? And so I can get the sense that especially as if I'm teaching, that I'm creating this kind of idea that these things are separate. And so I need to be careful there. So I will. But I am curious what you think. If you're dealing with anger a lot, what do you think about that?
Well, I'm not particularly addressing the visceral work.
Right.
I'm addressing
The
what
feeling.
is the feeling.
Right.
When that's strong, that's what I'm addressing.
Right.
Why am I addressing it? Because it is so strong that there's no way to go around it.
Right.
I cannot go around it, and I don't want to go around it. I want to
Right.
address it.
Yeah.
And it may clean up their liver. Who knows?
What do you think? Do you think it
I
does?
don't know because it's not my.
It's not. I was just curious what you
just
thought.
have no. I don't know.
Give me an answer. No, I'm just
No,
kidding.
I don't know. I don't know. I'll send them to you.
No, I don't know either. I'm like playing.
But it could happen. Yeah.
This work is a playground of sorts, right?
It is. Yeah.
Yeah.
Yeah. It's totally.
One of the
a
things
playground.
we're really being mindful of is the world wanting to make this not a playground. And
Right.
and so I have some voice in the community. I certainly have some voice in the community locally. And so I'm wanting to stay a playground.
Yeah.
And that this work is largely realized through work and not through study. Study, again, is important.
Yeah.
But there's this really delicate balance between the two. So
Yeah.
I know we kind of keep going back to that same subject, but I do really appreciate that about the playground aspect of this.
Yeah.
That we get into these places where we should be qualified and we ought to be qualified.
Yeah.
But in that, we have to have this, we got to get out of protocol, that's for sure.
Absolutely. Yeah.
Yeah. And even the closest I'll come to protocol is where I start. And that is conversation.
All right.
That's the closest I'll come to being the same every time.
Yeah.
And then a lot of times when people are in low vibration states, their patterns are very similar, as you may know. And so it looks like I'm in a protocol and I'm not. I'm actually in a pattern. And as people begin to vibrate higher, one of the things we see here is that people become far more individual.
Yeah.
That's actually where their creative self lies, is in this high
Yeah.
vibration state. And so we do a lot of work to get them there.
Yeah.
Yeah.
That's very, very valuable and very much needed.
Right.
Very much needed.
Well, and anger is a common, unacceptable experience. It is. We watch it here. Like we treat a lot of moms here, and they are angry.
Yeah.
But they're not angry because they're not supposed to be angry. But they are angry.
They are.
You know.
And so what?
So we've got to get some bats, I think.
Yeah. Yeah. And so what? So you're angry. Are you also afraid? Yes, I'm also afraid. That's also an emotion. Anger is just an emotion.
Right.
And that's what I want to get down to with anger. That it's
just an emotion.
It's just in the range of emotion. It's just an emotion.
Right.
It's just the emotion that's not accepted. But it's just an emotion.
So when you assess someone angry at a 12, you back out, interact with them at more of a distance, and begin to work with them without touch. Would you then move back to touch as they become? Let's say that they move.
Once they've expressed themselves,
right?
Yeah, then I have them back on the table.
They'll be back at a 6 or 7 or something, and then you're.
I could check back with them, but before I get back on the table, I just let them stand.
Right.
Just feel your feet. Just close
back
your
in
eyes.
their body.
Go back in your body. Just take a bit of time so that all these intense sensations can kind of settle. And let me know, what are you feeling in your body right now?
Right.
I'm not going to the numbers. What are you feeling in your body? Oh, I feel relieved.
Right.
Oh, my belly's relaxed.
And that's
now.
like an invitation.
Yeah.
Yeah.
And
Beautiful.
that's okay. So if you look at your anger now, on a scale of 1 to 10, it's not there.
Right.
Right. So let's get back on the table.
There you go. I like that.
And then we continue. And what I regularly notice, that once they're on the table again and I start touching, I get a tendency to fill up time, because it's actually the session is finished.
Right.
What needed to happen has happened.
Yeah.
So I check with them. Is there anything still you want or that you need from me?
Like, are you feeling incomplete? Or
like that. And usually the answer is no. I'm really fine now. And it's okay. I'll put a blanket on you. I go drink and go to the toilet, and I'll get back to you.
Right.
Enjoy the space.
Nice.
That's why they often say, enjoy the space.
Nice.
Yeah, it's a very valuable space.
Yeah.
All right. So, do you have anything else for us? That's a very broad. I can ask a more specific question if you like, but let's start there.
Yeah, please.
You want a more specific question?
Yeah, please. Because I noticed there was a question about resistance, and I think that's very interesting.
So we'd love to hear you talk about resistance, both from the client's experience and as far as the therapist goes.
Yeah. Well, in my perception, I noticed there's two types of resistance. It's a resistance to feel, a resistance to go inside, a resistance to connect with whatever is to be experienced inside.
Right.
I would call that resistance. And the body expresses it through tensing up or withdrawing or pushing outwards. It has its own physical reactions to that. But there's also a resistance I would call the Buddha quality of resistance, which just tells me like, no. It's very simple. It just says, no, this is not a place to go. No, I don't want this. It just tells the truth of the situation, that it's up to here and no further. The one is workable, the other one shouldn't be worked on because it's very authentic.
Right.
And I love resistance. I've come to love resistance because it tells me as a therapist just to hang in there, to wait, not to push, get inquisitive, respect the resistance, because my hunch is it's there for a good reason. It may not be functional anymore, but as a pattern, there must be a belief system that makes the body tense up in resistance. and I get interested in that. So,
Right.
what is it that you're resisting? Is it, for instance, is it me? Is it my touch? Is it coming from outside?
Right.
Or are you resisting what's underneath that? Is it resisting what you feel? Or is it both? So best I can do is get interested and have people look into that and find out. And also, what I often do is okay, I totally respect this resistance, but what my hand can do is I can feel through it, respectfully feel through it,
Mm-hmm.
space underneath that. Can you do that too?
Yeah.
I asked them, can you also go
Absolutely.
there?
Ah, that's
And it's in a safe environment of your resistance, but we can still maybe
Mm,
go underneath it and just check, what are you feeling underneath?
right. Huh.
And then I noticed, to my big surprise, that without exception, everybody knows what they're feeling there. Everybody knows,
Right.
because it's safe to go there, and nothing is expected, and the resistance is respected.
Wow. I love that.
That's a
Mhm.
way
That's beautiful.
Mhm.
access it.
Hmm.
Mm.
And then often it just breaks down.
Right.
The resistance breaks down because it just loses the value.
Right.
Yes,
Well, its power in part, if not in whole, was being unseen.
yeah,
And so the moment it's seen, I mean, we see that all the time when we're taking people back to childhood related issues, and they're like, well, what are we going to do once we find it?
yeah,
I'm like, there's nothing. Once you find it, it's gone. Like it does. It's relied. Its power it's had over you has in being
yeah.
not being distinguished, and so it's kind of magical, actually.
It is kind of
Yeah,
magical.
it's magical. It has this kind of magic
But
quality to it.
also, as a therapist, it's magical because you don't expect it. It's not a
Yeah.
trick.
It's not a trick.
It's not
right.
a trick. It's like
Right.
being truthful.
Yeah.
Yeah, seeing it
Yeah.
and making someone see it themselves.
Right. Jumping subject here as we kind of start moving towards the end of our time together here.
Yeah,
You and I on the drive in this morning. I'm glad I live a long ways away from here. It was really nice to have some time with you. And I'm assuming that's the biggest truck you've ever been in, right?
this.
Yeah.
No, your truck.
Yeah.
That's the biggest truck I've ever
Okay,
been in.
good. So
Yeah.
I thought so. It's welcome to Texas.
Thanks. I missed the cowboy hat.
Yeah, we're talking about a rodeo for him, so
Oh.
let's go. Rodeo. He loves country and western dancing, right?
I
No.
don't know.
No, he doesn't know.
We can make that happen.
So,
no.
but what we talked about, we landed on a word that both of you and I have some history with, and we like a lot, and that is inquiry.
Yeah.
And that is a really important word to me. For me, it means curiosity in some ways.
Yeah.
But I would love to hear you say a little bit about it, because I know you carry a lot of wisdom regarding inquiry, and especially around the body work.
Yeah. How I'm using inquiry is mainly when I'm touching. And how do I recognize when it's needed to inquire? I just get interested. It's like a natural interest just
Right.
gets me. And then I start wondering, what am I feeling? What am I touching? Like questions come by themselves.
Right.
And I start ask the questions in a way that the questions are mainly body based. So people have to bring their mind inside their body
Right.
and translate what they're feeling.
Right.
But part of it may be that it triggers memories or it triggers a story. And if that's useful, I want to hear it. If it's not useful, I ask them, is it
Right.
useful? No, it's not useful.
Right.
It's distracting. So come back to the feeling.
So
Does this answer your question?
it does. I want to kind of answer it with you and see if we're in the same place. This
Yeah.
would be really fun. I look at inquiry and curiosity very not so much the same as maybe coexistent, in that you used the word wonder,
Yeah.
and that the difference between the thing is with curiosity and inquiry is there, or just the general asking of questions, is that there are questions asked, in the state of inquiry.
Yeah.
The difference is that in the state of inquiry, we're not really looking for answers.
No.
We're in a state of wonder,
Yeah.
and we're looking for movement,
Yeah.
not answers. And the moment we start, and we might land on an answer, but if we're committed to the state of inquiry or curiosity, we'll immediately move to a new series of questions
Yes.
that once again generate more movement.
Yes.
And that's the beauty of it, is that we have, this is not the beauty of it, but an aspect of this in my mind is that we're raised in a culture that is answer oriented, and it's often making up answers that are not true.
Yeah.
Because it's committed to having to have an answer.
Yeah.
And we often get clients like that. They're like, I just need to know the answer. And I will ask them, what if you get completely better and you never know why? And most of them go, that is absolutely not okay.
No.
And so what do we go to work on? That.
Yeah.
And because one of the things we need from them is for us to be able to ask, generate questions and curiosity, and create movement. And one of the things we like about that is that there's not a lot of reasons for what you find there. There's not a lot of justification for it. There's not a lot of mental noise. It just is.
Yeah.
And so often when we're working and teaching therapists here, we're getting them asking really valuable questions to clients.
Yeah.
We're getting them to sound a particular way about it. And wonder is a good way.
Yeah. Beautiful.
Because wonder is actually a sound.
Yeah. Oh, okay.
You know,
yeah.
like I wonder, right? It sounds, it's carried in a particular part of the throat. It's not in the front of the mouth. It's not, it's curious. I wonder.
It's more in the back of
Wonder.
the
It's in the
throat,
back of the throat, right? And so can I wonder from the front of my throat? No. And one of the things we like about bodywork here is that we're also moving people back into those areas. We're getting them out of the front of their throat, fingertips and toes, getting them back in their body. And that's where wonder is.
Yeah.
And so it doesn't just have to be a practice for them. It's something we can physiologically cause through body work. So that's my thoughts. Thank you. So we have had a blast with you. This has been great. And we've just gotten started. You've been on the ground here for like not very long, a day. And not even a day. I am in your class this weekend, and so I really appreciate that, and that I'm there. And we've been careful to put that class together for you, so it wasn't just opened up to the public. We handpicked, and the people that brought you the idea of you coming here. They don't ever do that, and so I don't know what that means, other than I know it's very special. And so the Kekino Institute of Healing appreciates that you carry that kind of clout, if you will, and we appreciate that about you. And one of the things we do know how to do here is to be ready for you, and ready to play and to go deep, if that's what's required of us. And so we just want to thank you so much for being here.
Thank you.
This conversation has been delightful.
Yeah.
And Marnie,
thank you.
Thank you for being here.
Thank you.
And thank you so much for sitting with me.
Let's see what happens in these 4 days. Sometimes I think it's so ordinary what I'm presenting, and it's nothing special. Not that it needs to be special, but it's because I'm so used to doing it many times.
Right.
But then I remember when Amy was there last year, I talked with Amy this morning and asked her, so what made you ask me? And then she said, I thought it was so, special is not the right word. But what got her was the variation in the program, the playfulness in the exercises, and also the simplicity and the reflection in the simplicity, how it made her so aware, that like the slowing down.
Right.
The slowing down, and how the slowing down has such a powerful effect.
Yeah. Yeah, it's true. Most of us think if we're going to heal something, we need to speed up and heal it. We've got an entire, pharmaceutical industry that will back us up on that, and that will really very much put that upon us.
Yeah.
And we, as an institute here, we decline that.
Absolutely.
And we not only decline that in language, we like in the activities and the things we support will fall in resistance to that.
Yeah.
And so
do I.
So I appreciate that.
Yeah. And we need to slow down. And sometimes, like in a setting like the workshop, speeding up may be helpful
Right.
to get to a deeper sense of slowing down.
Right.
So I like that combination of activating and then
Well, is it not
falling
true
back
that if we
inwards.
have the value of slowing down, then we also that inadvertently means
Yes.
that speeding up has value as
Yeah.
well, and we
If
can apply that to
we
so
can
many different levels.
and we
right?
can play with that.
Right.
And that's a part of the way I like
Right.
to work with this SOAS workshop is it's going to be a play also. It's going to be playful. It's going to be having a lightness. It's going to be having an intensity and a depth as much as it wants to happen. And that's
Yeah.
not dependent on me. That's dependent on us because we're all in it. I'm in it. You're in it.
Yeah.
We are in it. And that's the interplay I'm very interested in how that's going to unfold.
That'll be fantastic.
Yeah.
That is great. So last, you got anything last before we close?
Oh, I just feel so welcome here.
You are very welcome here. That is for sure. We're so glad you're
and
here.
and I feel in the right place. Like
Thank you.
talking with you and
Yes.
hearing your experience, I just feel kind of humbling. Like, oh, you really have
Thank
a lot
you.
of experience in fields that I haven't been exploring in that way. So I'm learning from you, just
Well,
being
thank
hanging
you.
out with you.
You're making me blush now. Thank you.
Yeah.
So on this embarrassed note, thank you, humbly. So thank you so much. So you've been watching Touch Revolution here. This is John James with Kekino Institute of Healing, and so thank you so much for joining us.